Okay. There are many different treatment options for families dealing with Rett syndrome depending on the severity of the disorder. In most cases, patients receive assistance with feeding, diapering, supplemental feeding, especially for those individuals with slow growth due to the Rett syndrome. Physical therapy, usually for the hands with the hand use regression, but also often with the legs and walking. Medications are also a possible treatment for various complications such as the seizures that come along with it. As far as ideas for teaching or working with individuals with Rett syndrome, the biggest recommendation is to start with early exposure to age-appropriate music, toys, and books. And research has said that that is one of the most important things for all children, but especially those with Rett syndrome. It is also suggested to always allow enough time for the individual to take in information, as well as enough time to be able to respond to it in their own way, which could be, eye movements, some sort of purposeful body movement, hand movement, something along those lines. Providing an environment and situations that are strongly motivating will make it easier for the individual to show what they understand and will allow for greater success and self-satisfaction. The biggest goal in education should be to provide individuals with the most stimulating program in the least restrictive environment, taking into account each girl's own very special needs. That is what I learned about Rett syndrome. I was actually really intrigued by it, to be honest. I am a little surprised that I wish that there was more information out there, just more knowledge for families and medical professionals so that it can be diagnosed earlier and more concrete, because it's pretty devastating, I'm sure, for families to have a misdiagnosis. So anyway, that is, it's very interesting to me, and I hope that it was to you. Thanks.